Structural heart disease, also known as structural cardiac disease, is a collection of heart diseases that includes diseases of heart structure, heart failure, hypertrophic cardiomyopathy, and congenital heart disease. Today on Beyond the Stethoscope, Dr. Hitesh Raheja, a cardiologist in the Trinity Health Mid-Atlantic Medical Group, is here to tell us about the latest advancement in structural heart procedure and the latest technology being deployed in our area. Thank you so much for joining me today.
Thank you for having me.
Thank you. And admittedly, this is something, structural heart procedure, that I know very little about. So I'm really looking forward to our conversation. Would you mind just kicking us off and telling me what is structural heart procedure?
Sure. So as the name implies, structural heart disease means any diseases that are related to structure of the heart. So every human heart has 4 chambers, 4 valves, and the arteries connecting these chambers to the rest of the body. So diseases that involve any leakiness or tightness of the valves of the heart chambers, or like 2 abnormal connections, like holes between 2 sides of the heart, abnormalities in the arteries or the vessels of the heart, those things come under structural heart disease. What's the difference between structural heart disease versus traditional surgeries that you would know is that structural heart diseases, the procedures that we do, we basically go in a very minimally invasive way and do these procedures, like replace a valve inside the heart called aortic valve by just going through the groin rather than doing open heart surgery. So that's the main benefit of doing structural heart procedures compared to open heart surgery as we used to do traditionally.
Gotcha. So what would the risks, like when you're chatting with a patient about what sort of surgery to have, what are the risks that come along with structural heart procedures?
Sure. So any cardiac procedure, we do. There's some risk involved, and some of the risks, obviously not limited to, are stroke, heart attack, or bleeding from the access site or from inside the heart. But again, these those are the procedures that we do, are that the risks that are involved are less compared to, because these are minimally invasive surgeries. These are the risks are much less compared to an open heart surgery. So some procedures that we do, I mean, there's small chance of bleeding, there's small chance of stroke, but this is not more than open heart surgery. The chances of having those complications are less than open heart surgeries, and that's why the procedures are safer and better tolerated for patients.
So a patient with, so are these 2 procedures, they're meant to treat the same thing? One is just more minimally invasive, or they treat like open heart versus structural?
There's a lot of overlap. So there are certain diseases that can only be treated by open heart surgery, and there are certain diseases that I would do structural heart. But yes, most commonly, many procedures would be there that can be done by open heart surgery, as well as this percutaneous minimally invasive approaches. So the way we decided is basically on the patient's profile, like what's the patient's age, if the patient is a good candidate for open heart surgery or not. Like in the past, many of these patients, like let's say 70 or 80-year-old patients who are not candidates for open heart surgery, there would be no treatments for them. So they would basically suffer from shortness of breath, heart failure, and they die of these diseases because there were no treatments, let's say a few years ago. But now, because of the availability of these procedures, which are minimally invasive through the groin artery, or some, we don't have to do, patients who are not good candidates for open heart surgeries, they can also get these treatments done and live a long and healthy life. So the way we choose it, as I said, multiple factors go into it. It's always a heart team approach that we take. Basically, the surgeons, the structural and interventional cardiologists like myself, and the cardiac surgeons, we always make a plan. What's the best procedure for the patient, depending upon the patient's profile.
Okay, so you mentioned their profile, so age obviously is a factor. Anything else that would contribute to this decision?
Age, obviously, how their kidney function is, how their liver function is, how if they have any lung diseases, right? If they're able to go through rehab. Let's say if you do open heart surgery, you need 6 weeks of physical activity rehab. Some patients will not tolerate it. Some patients are not active enough to go through rehab and recovery process. So those patients are not good candidates for open heart surgery. So we would do groin approach for them. When we do groin procedures, especially let's say if I replace aortic valve through groin, most patients they go home the next day.
Wow.
So
the next day.
Next day. And many procedures we send the patients now home the same day. While compared to open heart surgery, obviously you will stay in the hospital 4-5 days. Then you have recovery time is like a month or more, right? So that's the major benefit of these procedures. And the outcomes of open heart, the percutaneous approaches of how we do it is similar or even better than surgical procedures in certain diseases.
Wow, that's incredible. So yeah, you kind of answered my next question was about, but if you want to touch more on the healing process.
Yeah. So we did, let's say if we did, like yesterday we did two valve replacements from the groin, right? So those patients are very healed well because there's a small incision in the groin, which we closed then and there, and patients walk in 4 hours. And
they're walking in 4 hours. I just have to repeat that.
Yeah,
that's incredible.
They walk in 4 hours. Exactly. The 4 hours is the bed rest time after valve replacement, and they walk in 4 hours and they go home the next day. So they do the normal functioning next day. So that's the healing process. It's just a small incision, and it just heals like it's a small cut for you, right? It heals. So it's not that's the main benefit. And it's not only, it's multiple procedures that we can do. So as I said, there are multiple valves of the heart, like aortic valve is one of them, mitral valve is another of them. So leakiness and tightness of these valves is the most common diseases that we deal in structural heart disease. So they go home, as I said, recovery is fast and they go home the next day. Another common procedure that we deal with is as an abnormal holes between two sides of the heart, and especially in younger patients, if there are certain kinds of holes, they can cause stroke. So closing them is very important, especially in younger patients. Those are also can be done through groin approaches, and they heal the same day and go home the same day and walk the next day. So
incredible. And is it always through the groin that you access?
No, we can always go from the other. So groins are multiple arteries we can use. We can also use the arteries from the arm. We can also use the neck arteries and the arteries of the legs also, depending upon which we think is the. We always do imaging and check all that before the procedure. So whatever we think is the best approach for reaching where we need to go, we use that artery to go with, basically, or the vessel. Yeah.
What kind of technology is used in this procedure?
Yeah, so it depends. It varies from procedure to procedures. Structural heart is a very advancing field, and it basically there's new advancements, new techniques coming every day. So they're like if I'd say valve replacement, there are 3 types of valves, and they're more and more advanced now. Three of them are FDA approved now. More and more procedures are being done in a very very like a 2 centimeter, 1 centimeter incision. The camera that we use now, they used to be not that great. Now the camera is used, it's like a 4-dimensional. So it basically I can put that camera from one of the arteries, as I said, from the leg artery, and go look into the heart. And it's amazing the images that we see from that, right? So there's, as I said, advancements every day, and more and more techniques are coming out every day. So
incredible. How new is this procedure, like in terms of your field of medicine?
Yeah, so again, it depends on if I'm talking about one of the most common is aortic valve. It has been there for 10-15 years now, but again, it's advancing every day, right?
Sounds like it.
But certain procedures, like another valve, like mitral valve procedure, this is very new, like in maybe last 4 or 5 years is Then the other right side of the heart also has another valve, which is also if it leaks. We can fix that also now. This is very new. Like it was recently approved by FDA like 2 years ago.
Wow.
So I think the multiple procedures are being, as we go forward, there are certain techniques which are very new, and certain they have been there for some time now. Yeah. So that's the great part about this field. So.
Amazing. Before we close today, I just thank you so much because I've felt like I've learned so much from you. Is there anything else you'd like to add in closing?
Now, I think for patients, I would say that if you develop any symptoms of shortness of breath or any symptoms that you feel like more fatigue, more shortness of breath, and like something things that now take more effort to do compared to, let's say, 1 year or 2 years ago. Many patients would just defer it and say that it's because of my age. But I think you should tell that to your physician, and you should look more into the heart diseases that cause these symptoms. Because if left untreated, they would keep causing the symptoms, and the symptoms will keep getting worse, and they will eventually take their life. These things.
Yeah.
Another thing I would say is when we choose where to go, which hospital to go, or which doctor to go for structural heart procedures, it's a very specialized field, so it needs a lot of training. Even after cardiology, you do 1 more year of interventional, then you do 1 more year of structural fellowship. So always look at a place who do a lot of procedures, and the doctors who are like specifically trained in structural heart and have done a structural heart fellowship. That would always be beneficial for the patient. Yeah,
It sounds like it. So they need to do their research. And I know the hospital is very lucky to have you.
Oh, thank you so much.
And thank you so much for your time today. This has been really, really neat.
Thank you so much.
Thank you. And if you or a loved one is struggling with cardiac disease and believe this type of procedure may help, you can find out how to make an appointment with Dr. Raheja in the link in the description below. Make sure you hit the subscribe button to get new episodes of Beyond the Stethoscope every other Thursday.